There are a lot of people that are looking very closely at what we, the healthcare providers, are doing. And with good reason. As I've mentioned, this concern weighs heavily on everybody's minds.
You know what has worked, but you also know what didn't work very well, and you know your market very well. My whole goal here is that you take away some nuggets of marketing.
At that point, I can get out of the situation, because now they've learned about this process of communication, different than the content. The content is, you know, what's the cost-benefit analysis, and what's the Gantt chart going to help us do and be accountable. But this is the process of communication that's vital, that's crucial to any kind of relationship.
There are different global periods depending on what product to use. I've recently come to understand that CMS not only expects you to do a wound evaluation for which this can be calculated, but that you also discuss how much wastage you have.
It's no different than a lot of the healthcare rules that are state-driven too. And so even Medicaid versus Medicare, while it's a federal program, each state will function and operate differently.
Yep.
And so you get the same challenge outside of the employment context.
I will tell you that there is a focus on your own business and how you do business, and that's one whole part of this strategic planning is how I operate in these environments. And the other part is how I interface with the environment that I'm working with. And I think those are two very distinct and different animals.
The reality is the times demand that third parties have a clearer understanding of what we are doing. So in this particular conference, you are going to learn about making the case for the value of your services. In the world of coding and billing management, we refer to that as medical necessity.